Hey there! Choosing a relapsing MS treatment can come with some big questions, like does it work and is it safe? It can be a lot. I'm going to help you break down what the KESIMPTA studies show, what it could mean for you, and what to know about possible side effects. Now let's get into it. Let's start with results. Making a treatment choice is a big decision, and there's lots to know. The thing that's top of mind is, does it work? Let's take a look into how KESIMPTA was studied. So there were two clinical trials that measured the KESIMPTA results against another common RMS treatment called teriflunomide. Here, we learned how KESIMPTA can impact RMS activity, more specifically, reduced relapses, lesions, and slowed disability progression. KESIMPTA was proven superior in each of these categories versus teriflunomide. Let's take a look. First, let's take a look at relapses. In the first study, KESIMPTA reduced the rate of relapses by 51% and 58% in the second study. That means the relapse rate was reduced by more than half compared to the other treatment. If you're wondering what rate of relapses means, it's the average number of relapses people had in a year. Now, moving on to lesions. KESIMPTA showed a major reduction in lesion activity measured on MRIs. In the two studies, there were 98% and 94% fewer active lesions, and 82% and 85% fewer new or enlarging ones. In simple terms, this means that in both studies, KESIMPTA showed way less lesions. Okay, now let's talk about disability progression, something that's probably top of mind for most folks when choosing an RMS treatment. The studies measured this with something called the Expanded Disability Status Score, or EDSS. It's commonly used to measure disability and track progression over time. The score is determined by assessing certain areas of functionality. The higher the score, the greater level of disability. And what we see is that KESIMPTA slowed disability progression. It was 34% less likely at 3 months and 32% less likely at 6 months. So just to recap, KESIMPTA had powerful results in the three major areas of MS activity: relapses, lesions, and disability progression. We know that KESIMPTA was proven superior versus teriflunomide, but what about other treatments? Well, it can be tricky to compare results between different treatments because each study is designed differently, so they're not apples to apples. Your doctor can help you figure this out. They know your case best and can address your unique concerns. Now that we've covered results, let's move on to safety profile and side effects. I know that can be a big one for a lot of people. We've all seen those commercials with a long list of side effects. The truth is, every treatment comes with some potential side effects, but understanding what they actually mean and what is most likely can help you make the best decision for you. The first thing to know is that KESIMPTA has a proven safety profile and has been well studied for 7 years and counting. So rest assured, safety is always a priority. Before we dive into all the details, you should know that very few people in the studies stopped KESIMPTA due to side effects. There could be some risk of serious infections such as HBV and PML, a rare brain infection. There weren't any cases of PML reported in clinical trials for KESIMPTA. If you don't know what these infections are, don't worry. Before you get started on KESIMPTA, you'll get a blood test for any infections. That way, you and your doctor can talk next steps. Now, let's talk about some other possible side effects. Because KESIMPTA is taken with an auto-injector pen, local site reactions could occur. Injection-related reactions are most common with the first injection, but usually get better after that first dose. In fact, 99.8% of these reactions were mild to moderate. KESIMPTA may also lower the levels of immunoglobulins, which is a fancy word for antibodies. Your doctor will do blood tests to check your levels before you get started. B-cell therapies, including KESIMPTA, can carry the risk of liver damage. So your doctor will also do blood tests to check your liver before you get started and while you're on KESIMPTA if needed. There are a few symptoms you should tell your doctor about if you notice them. The most common symptoms are like the ones you'd expect with a common cold. So what do you do with all this info? Hopefully this helped you understand the safety profile of KESIMPTA a bit more. But when you choose to start KESIMPTA, your doctor will go over it again. You should also let them know if you have other important health-related stuff going on, including anything you see here. Oh, and one last thing. It may sound obvious, but if you've ever had an allergic reaction to KESIMPTA, you shouldn't take it, so let your doctor know. So that covers the basics for results and safety profile. I know that was kind of a lot, but hopefully this can help you feel more comfortable about making such an important decision. And of course, we all love to search the internet for information, but your doctor is an expert and will be your best resource to making a confident and well-informed decision. Well, that's my time. Bye for now. Check out KESIMPTA.com or the KESIMPTA YouTube channel for more about clinical trials, safety profile, and real patient stories.
Indication. What is KESIMPTA, ofatumumab injection? KESIMPTA is a prescription medicine used to treat adults with relapsing forms of multiple sclerosis, MS, including clinically isolated syndrome, CIS, relapsing remitting disease, and active secondary progressive disease. It is not known if KESIMPTA is safe or effective in children. Important safety information. Who should not take KESIMPTA? Do not take KESIMPTA if you have an active hepatitis B virus HBV infection, have had an allergic reaction to ofatumumab or life-threatening injection-related reaction to KESIMPTA. What is the most important information I should know about KESIMPTA? KESIMPTA can cause serious side effects such as infections. Serious infections, which can be life-threatening or cause death, can happen during treatment with KESIMPTA. If you have an active infection, your healthcare provider, HCP, should delay your treatment with KESIMPTA until your infection is gone. KESIMPTA taken before or after other medicines that weaken the immune system may increase your risk of getting infections. Tell your HCP right away if you have any infections or get any symptoms including painful and frequent urination, nasal congestion, runny nose, sore throat, fever, chills, cough, or body aches. HBV reactivation. If you have ever had HBV infection, it may become active again during or after treatment with KESIMPTA, reactivation. If this happens, it may cause serious liver problems, including liver failure or death. Before starting KESIMPTA, your HCP will do a blood test to check for HBV. They will also continue to monitor you during and after treatment with KESIMPTA for HBV. Tell your HCP right away if you get worsening tiredness or yellowing of your skin or the white part of your eyes. Progressive multifocal leukoencephalopathy, PML. PML may happen with KESIMPTA. PML is a rare, serious brain infection caused by a virus that may get worse over days or weeks. PML can result in death or severe disability. Tell your HCP right away if you have any new or worsening neurologic signs or symptoms. These may include weakness on one side of your body, loss of coordination in arms and legs, vision problems, changes in thinking and memory, which may lead to confusion and personality changes. Weakened immune system. KESIMPTA taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Before you take KESIMPTA, tell your HCP about all your medical conditions, including if you have or think you have an infection, including HBV or PML, have ever taken, currently take, or plan to take medicines that affect your immune system. These medicines could increase your risk of getting an infection. Have a history of liver problems. Have had a recent vaccination or are scheduled to receive any vaccinations. You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with KESIMPTA. You should not receive live or live attenuated vaccines while you are being treated with KESIMPTA and until your HCP tells you that your immune system is no longer weakened. Whenever possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with KESIMPTA. Talk to your HCP about vaccinations for your baby if you used KESIMPTA during your pregnancy. Are pregnant, think that you might be pregnant, or plan to become pregnant. It is not known if KESIMPTA will harm your unborn baby. Females who can become pregnant should use birth control, contraception, during treatment with KESIMPTA and for 6 months after your last treatment. Talk with your HCP about what birth control method is right for you during this time. Are breastfeeding or plan to breastfeed. It is not known if KESIMPTA passes into your breast milk. Talk to your HCP about the best way to feed your baby if you take KESIMPTA. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use KESIMPTA? See the detailed instructions for use that comes with KESIMPTA for information about how to prepare and inject a dose of KESIMPTA and how to properly throw away, dispose of, used KESIMPTA Senso-Ready pens or pre-filled syringes. Use KESIMPTA exactly as your HCP tells you to use it. Your HCP will show you how to prepare and inject KESIMPTA the right way before you use it for the first time. Do not inject into areas where the skin is tender, bruised, red, scaly, or hard. Avoid areas with moles, scars, or stretch marks. KESIMPTA may cause serious side effects, including injection-related reactions. Injection-related reactions are a common side effect of KESIMPTA. Injecting KESIMPTA can cause injection-related reactions that can happen within 24 hours, 1 day, following the first injections and with later injections. There are 2 kinds of reactions: at or near the injection site. Redness of the skin, swelling, itching, and pain. Talk to your HCP if you have any of these signs and symptoms. That may happen when certain substances are released in your body: fever, headache, pain in the muscles, chills, tiredness, rash, hives, trouble breathing, swelling of the face, eyelids, lips, mouth, tongue and throat, and feeling faint or chest tightness. Contact your HCP right away if you experience any of these signs and symptoms, especially if they become worse or you have new severe signs of reactions after subsequent injections. It could be a sign of an allergic reaction, which can be serious. Low immunoglobulins. KESIMPTA may cause a decrease in some types of antibodies. Your HCP will do blood tests to check your blood immunoglobulin levels. Liver damage. KESIMPTA may cause liver damage. Your HCP will do blood tests to check your liver before you start KESIMPTA and while you take KESIMPTA if needed. Tell your HCP right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. The most common side effects of KESIMPTA include upper respiratory tract infection with symptoms such as sore throat and runny nose, and headache. Headache. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide, on this site or at www.kesimpta.com.